Hi again. This is Nancy from the Chi Center at NIAC Acupuncture. I'm just here again because I want to stay true to my promise of sending educational videos out to the community at large on Facebook, but primarily I am in the Rockland County, New York area, so this is for you guys. I have been thinking a little bit about some questions that I think the public might have about acupuncture, and there's one in particular that I want to address, and this is the idea of who should practice acupuncture, what is out there as far as acupuncturists are concerned. So I just think it's very simple things to know. There's licensed acupuncturists, certified acupuncturists, and even some more advanced doctorates of acupuncture that we can distinguish from. You'll hear of some certified acupuncturists, although you might not know they're certified, being chiropractors and physical therapists and even some MDs out there that have taken some courses in acupuncture and are doing acupuncture in their clinic. Maybe they're not calling it acupuncture, and maybe they are. There could be, there is this new thing out now called dry needling, which is confusing, I think, to a lot of people that they think it's not acupuncture. Let's just be clear, it's acupuncture, okay? It's the insertion of needles into your body, that's acupuncture. And the reason I bring this up is because I'm very concerned, and our community in general is very concerned about dry needlers and some of the issues going on with that. So you should know that dry needling is acupuncture. If you're a physical therapist or you're a chiropractor or somebody else tries to convince you to do some dry needling, and you should be cautious. Yeah. You should be cautious. They mostly don't have the kind of training we do as licensed acupuncturists. And unfortunately, there's been a lot of mishaps and accidents. And I think that's just based on the lack of education and lack of training they get. Sometimes it's very little. Sometimes it's just a day course. Sometimes it's a few weeks, but it's nowhere near the training that licensed acupuncturists have. And also you should know that licensed acupuncturists also do dry needling. So don't get confused, because that could be confusing out there. But of course we do acupuncture, and because dry needling is acupuncture, of course we do it, and it's a different style where you're putting needles mostly in muscles, and you're creating a lot of stimulation. It's usually some deep needling, and you got to be careful. You got to know who you're going to, and so don't go see a chiropractor for that or a physical therapist for that, unless this physical therapist is actually trained as an acupuncturist, a licensed acupuncturist, which there are out there too. So I don't want to negate that fact. There's some chiropractors that go through the full schooling, and MDs that go through the full schooling of licensed acupuncturists, which is at least 3 to 4 year training in the master's degree level. That's, anywhere between 2,500 and 3,000 hours, not 250 hours or less. They have to see at least 250 actual patients to treat, during the clinical portion of their education, and they have to pass national certifications exams, and of course do continuing education unit credits after the program. So every few years to stay registered, we have to take continuing education classes. So that's a little bit to know. I hope it's not confusing, but essentially it gives you, empowers you to ask the right questions when approached by a chiropractor or a physical therapist. In fact, I don't believe it's legal in New York State for a physical therapist to do dry needling, unless they're a licensed acupuncturist, right? Okay. Also, the other thing I wanted to say was that there are some licensed acupuncturists who do extra training, maybe 2 more years, and can be called doctors. And they have more of a training in Western research and medicine, which we do too. However, their education is based more on completing certain research courses. And the other thing you should know about doctors, or DAOMs they're called, or OMDs, is they're not any better than licensed acupuncturists per se. So don't be fooled in that area either. We have as high a training as they do, and sometimes postgraduate training for years and years after study, where the nature of this business is, and this art and this medicine is to pick mentors or pick fields that you really like, and you want to continue your breadth and depth of understanding of the medicine, which is, like I've said in the past, you could spend lifetimes and still not know it all. But a lot of us are still, I'm 15 years postgraduate school, and I'm still training with some of the greatest, and luckily I've been able to do that. So imagine your doctors still training after medical school and after they've gotten their licenses for 15, 20 years. So that's another distinction that should be made, okay? Licensed acupuncturists in New York State do not call themselves doctors unless they have a little extra training, but that doesn't mean we don't have the same or as good a training as the doctors that are out there. And one last thing I want to say about acupuncture in general, when you go see an acupuncturist, is there's so many different styles and so many different ways to approach this medicine, and the way to approach the thinking when you're with a live person, a live patient. And it is very well known that you can go to one acupuncturist and another one down the block, and they will approach the way they see you in a completely, entirely different way, perhaps. And that's okay, and that's great, and that's the beauty of this medicine, that it can be approached from all different angles and still give you quite a benefit for your whole system. So don't think that it's one size fits all, one prescription fits all. Different clinicians are trained in different styles: Chinese, Korean, Japanese, and 5-element theory. There's a lot of different approaches, and so that's how they can still have the same therapeutic outcome as another acupuncturist right down the block. Okay? All right. Always good to talk with you, and I hope to keep these coming as I think of them, and we'll talk about more stuff. Take care.